So our group did an IT solution for the current epidemic of avian influenza. It is commonly known as flu A, and our IT solution is called MagSafe Sanitation.
Avian influenza is a viral infection that spreads in birds, cows, and other animals. It is commonly known as bird flu, and it can sometimes spread to people. It was first identified in China in 1996 from an infected goose that led to a high mortality in three chicken farms in Hong Kong. The virus is transmitted between poultry primarily through direct or indirect exposure to respiratory secretions or feces of infected birds. Influenza A viruses are the only influenza viruses known to cause bird flu pandemics, i.e., global epidemics or flu disease. Next slide, please. There are different categories of avian influenza. It's categorized into low pathogenic LPAI and highly pathogenic HPAI strains. The influenza A virus is classified into subtypes based on two surface proteins, hemagglutinin H and neuraminidase N. There are 18 H subtypes and 11 N subtypes, leading to 131 possible combinations found in nature. The most notable avian influenza that's affecting humans is known as AH5N1. The variant H5N1 is known to cause significant illness and deaths in poultry, wild birds, and mammals. Next page, please. Bird flu in humans, infections, and symptoms. Bird flu is caused by the influenza A virus, often known as H5N1 in humans. It primarily infects the respiratory tract and the lungs, but can spread to the brain in rare cases. Infection is not caused or obtained from eating infected poultry, but more so interacting with animals that have the influenza virus. Human to human transmission is very rare, but there hasn't been any recorded cases in the U.S. Next slide, please. Diagnosis. Healthcare professionals or providers can diagnose avian flu with a throat or nose swab or from a conjunctive of your eye. The current test will detect highly pathogenic bird flu as influenza A. There are current treatments, the antiviral medications such as oseltamivir, which is taken in form of medication, and zanamivir, which is taken in a powdery form. Um, Paramivir is more so given in an injection way. And of course, supportive care such as rest, hydration, and symptom management can also help with treatment of bird flu. Next slide, please. Complications and preventions. If bird flu is not prevented, or if any humans have come in contact with the bird flu, they can sometimes experience complications such as pneumonia, acute respiratory distress, bacterial infections, sepsis, brain swelling. Preventions, more so to avoid contact with wild birds, poultry farms, and live animal markets. Always advised to wash hands after handling raw poultry or eggs. Using personal care protective devices such as masks, gloves, goggles also helps with preventing contracting bird flu from animals. Next slide, please.
Miranda, I think you're muted.
Thank you. We looked at the current IT solutions that are being implemented at a local level, at a national level, and at a global level. Currently, we looked at Atrium Health, Wake Forest Baptist, and their current practice for reporting avian influenza. So if a patient comes in with suspected symptoms of specifically avian influenza, they would do a rapid flu test that would be available at site, and then they would call the state epidemiologist and get the approval to proceed with the avian influenza specific testing. They would collect the needed swabs, and they would order those specific tests inside of their charting system, which is called Epic. And then for influenza A surveillance testing in ICU patients, there isn't any further action needed from the clinical care team other than what's presented above. But the lab will automatically send those extra samples to the state lab for further testing. And then from a national standpoint, there have been multiple tracker systems and dashboards that have been utilized by many different states and public health organizations to not only help monitor the spread, but also the impact of avian influenza. The first state that tried to implement an IT solution was Minnesota. They had an IT service help fight bird flu that was affecting poultry flocks and causing significant economic loss. So a little bit of background, Minnesota was the #1 turkey producer in the U.S. during this time, and they were experiencing $1 million losses. They had network expansion with like fiber network connections with different government agencies. They implemented different computer equipment, and then they also set up virtual offices to help with connections and collaborate with workers to government. What they implemented was a self-service application that was a tracker system that looked like a map where the farmers and producers could update this in real time, and it also helped with the effects of the unaffected and affected birds being taken to market. The farmers and consumers and the media were able to be updated on the latest news and impacts due to toll-free calls, web pages, and social posts that were able to be done. And then they were able to have more clear lines of communication. And then that hyperlink will take you to the Minnesota's response to the bird flu. It is a several page document if anyone would be interested in reading. Other states implemented a similar model, specifically North Carolina and Pennsylvania inquired about employing a similar data sharing model like Minnesota created. They had existing facilities become a command center, and then they expanded out through the states with the ability to have access to those critical tools. And then because of the IT solutions that were available, a lot of that critical work was able to be done directly in the field. Also nationally, the United States Department of Agriculture has on their website dashboards that give 30-day summaries. They are updated in real time, and it focuses more on the affected birds and the affected flocks in the nation. They also started working with a higher biosecurity due to the migratory seasons having higher infection rates from the wild birds to the flocks and farms. From a global standpoint, the Center of Disease Control came into play, and they monitor the influenza factors year-round and those activities. They have systems that are monitoring seasonal flu and then all the changes that can happen with those seasonal flu viruses, because that can be very significant in the way that we test and prepare. They collaborate with our state and local health departments to do this and get the real-time, most up-to-date data. They look at the different demographics, the different symptoms, the different clinical courses, and the exposure history of a person who is being tested for regular or novel influenza. And then they try to see how relatable that is to the actual avian influenza. The CDC is also looking at wastewater surveillance for influenza, specifically avian influenza. The wastewater itself cannot determine the source of the influenza to see if it is avian influenza and where it's specifically coming from, if it is. But they can look for the detection of the H5 factor to see if the wastewater has flu factors in it.
So all states use a CDC-approved diagnostic tool to detect avian influenza, ensuring accurate and consistent identification of cases. Effective management and response to the outbreaks are supported by dashboards and tracking systems, which do provide real-time data for decision-making. Enhanced surveillance and early detection help contain outbreaks quickly, while predictive modeling and risk assessment enable proactive measures. Additionally, global and coordination and communication are crucial for sharing information and ensuring a unified response to avian influenza threats. Next slide. The HPAI dashboard depicted here is designed to provide a current snapshot, as previously mentioned, of confirmed highly pathogenic avian influenza detections in the United States over the last 30 days. I think that's the wrong slide. Yeah, go back. Yeah. The HP. It's okay. The HPA dashboard depicted here is designed to provide a current snapshot of confirmed highly pathogenic avian influenza detections in the United States over the past 30 days. As of February 21st, 143 new commercial and backyard flocks have been tested and confirmed for the presence of the virus. As indicated by the dark green color, Ohio has had concerning rise in the incidence of new avian influenza cases in the past 30 days, totaling to affected commercial flocks of 49, one affected backyard flock, and approximately 7.1 million birds affected in this outbreak. It's important to note that this data is updated weekly. Next slide. Early detection of avian influenza by the CDC's flu surveillance systems ensures that all potential cases are tested to confirm the presence of the virus. Diagnostic tests specifically designed to detect H5 bird flu viruses are employed, and increasing the sampling frequency and size among flocks enhances the likelihood of detecting the virus. This proactive approach strengthens efforts to prevent and control the spread of avian influenza. Next slide. The implementation of monitoring tools like the HPAI dashboard has led to several successes and challenges. Key successes including fostering transparency, enhancing communication, and enabling more effective response measures. However, challenges do persist, such as the need for continuous funding and institutional support to maintain effectiveness. Additionally, the diverse sources of data, including regional farms, public health reports, and international bodies, complicate real-time standardization and verification. Next slide. The CDC has developed robust surveillance systems to monitor avian influenza, but concerns have emerged regarding the current presidential administration's impact on data surveillance and reporting tools. Key employee layoffs and communication freezes at federal health agencies have negatively affected public outreach and response efforts. These challenges have prompted the exploration of innovative solutions to further strengthen efforts in combating the avian influenza outbreak. Next slide.
So our idea for an innovative IT solution to help fight avian influenza is what we've called MagSafe Sanitation. With this system, an automated hand washer would be linked to an exit door or an entryway for poultry workers, and that could potentially limit the spread of bird flu. This door could be positioned at a barn, a chicken house, or a residence. And this idea comes from a machine learning protocol that was used to monitor and diagnose patients with early cognitive decline. Next slide. So the idea here is that adequate hand washing would trigger a forcing function that would allow the door or gate to open if and only if adequate hand washing has been fulfilled based on pattern recognition from a machine learning algorithm. This would be programmed so that 20 seconds of vigorous scrubbing would be adequate as based on the CDC guidelines for hand washing. And then this data could be uploaded via Bluetooth to a tracking system that was similar to the ones described earlier. Next slide. With this system, a computerized machine learning algorithm would detect hand movements, and those would be programmed to be adequate when hand washing was deemed to be thorough. Next slide. This could be used in various regions of the world, depending on the type of sink, because all that would be needed would be to program in the specific sink that is viewed from the camera placed above the sink. Next slide. And then the trajectory of hand movements would be compared to the defined patterns which have been programmed in to be adequate based on 20 seconds of vigorous hand washing. Next slide. Implementing this would be relatively inexpensive for most components. A Wi-Fi connection in most parts of the world is very inexpensive. Machine learning algorithms are available and are mostly free of charge and open source, and basic entry-level programming skills would be all that would be needed to take advantage of this. A sink with an overhead camera should be able to be obtained for perhaps a couple $100. The Bluetooth connection is inexpensive. According to ChatGPT, a magnetic door similar to a fire door in a medical center could cost up to $5,000 or more, depending upon weatherproofing needs, if this is on an outside gate versus an indoor type weatherproof facility. Transport of materials to the poultry farm or site could be costly, but most of these things I think would be able to fit in the back of a truck. Training, either virtually or with pictograms, would be very inexpensive. Next slide. For training, there has been work done regarding streaming video instructions for hand washing for influenza A, and that was found to be helpful when battling a flu outbreak. So streaming video over a Wi-Fi connection would be one of the anchors of training for MagSafe sanitation. In addition, pictograms posted at hand washing stations would be used to reinforce proper technique. And because we're using pictures like an IKEA furniture assembly sheet, this would be language and education agnostic, meaning it should be able to be used in really any part of the world and would not require a high level of education to decipher. Next slide. Because of COVID, which is so recent in our memories, we have several case study comparisons to use to help us with designing a solution based on information technology for bird flu. COVID provided a real-world laboratory in which technology was developed and tested, and some of these lessons could be helpful for us. Next slide. This is a picture of a solar-powered hand washer that was posted on CNN Africa's Instagram feed in early 2020 and was also featured in a CNN article. And basically, a group in Ghana assembled several recycled materials into a solar-powered hand washer. So you see in this picture, there's a 55-gallon drum with a sink mounted on top. Then on the stand above the sink, there is a solar cell, which is linked to a sensor. So the idea is when the person puts hands under the faucet of the sink, this triggers a sensor and soapy water is released. After 25 seconds of vigorous scrubbing, as based on the sensor, rinse water is released for rinsing of the hands. Next slide. In a separate part of the world, in Australia, school for children ages 5 through 18 published a different type of mobile automated hand washer. With this portable station, you see on the hand cart, there is a computer which is calculating data. Behind the mobile cart, there's a sink with a black arc over it, and that's a UV light. And so basically for this system, a UV tagged moisturizer is placed on the hands, and then the hands are scrubbed vigorously. The hands are then placed under a UV camera, and a UV light determines the adequacy of hand washing based on areas of the hands that do or do not show up under the UV light. A pressure mat is the trigger that starts the camera viewing of the hands. Next slide, please. So this, you can see here, it's a bit hard to see, but this is a picture of a hand under a UV light, and there are several white spots on the hand indicating areas that had been missed in the standard hand washing. So the adequacy of hand washing was judged based on the UV light reflection. Next slide, please. With these two case study comparisons, portability was really key. A lightweight solution, that's easy to move around and deploy, would be most helpful, I think, for these situations. For the UV tagged sanitizer, one limitation would be that it is not equipped, and it might be hard to adapt it for the use with soap and water. And so that may or may not be applicable depending on the location. Do the missed areas on the hands have more germs or microbes than the cleaned areas? That was not assessed. So that was also another potential limitation. Real-time feedback was given in both cases. First, the sensor for the solar-powered hand washer and the UV light for the school-based hand washer. So real-time feedback was given, but there was no assessment of future behavior change performed. So that's an important component as well. And then finally, concern over UV exposure for solution number 2 could be a problem because UVA radiation is carcinogenic in high doses. Next slide.
To just see the global perspective on bird flu prevention, avian influenza is a global health threat affecting both developed and developing nations around the world. Since 2003, over 400 million poultry have died or have been culled due to the bird flu H5N1, causing $20 billion in economic losses. Between 2003 and 2011, the virus infected over 500 people and have caused more than 300 deaths, as according to the World Health Organization's resources. Large reservoirs of bird flu still exist in parts of Asia and the Middle East, where the disease has become endemic. These organizations, such as World Health, WHO, or UNICEF, have led in the global prevention education response to reduce the spread of bird flu worldwide. Next slide, please. A little bit more about these organizations. The World Health Organization is a specialized agency of the United Nations focused on global public health, and they play a key role in health education around the world. And UNICEF also is a global organization dedicated to improving the health education around the world. These agencies, organizations help in training farmers on biosecurity measures, which can help with reducing outbreaks, and also teaching them how to navigate or getting digital or internet access, which can help with improving outreach. And they also help with community engagement, which ensures long-term adoption of preventive measures of preventing bird flu spreading. Next slide, please. The global implementation of the MagSafe sanitation technology, automated hand washing stations that are linked to exit doors from poultry farms can significantly reduce the spread of bird flu. These hand washing stations can be wired or Bluetooth enabled for gate access at entry and exit points. And the placements will be next to farms, barns, chicken houses, and residencies just to ensure maximum biosecurity. Next slide, please. There are some countries that will face some issues due to having limited resources in implementing the MagSafe sanitation technology. These countries, such as Egypt, that experience an endemic infection with significant human cases, and countries like Indonesia, Vietnam, Nigeria that have high bird flu prevalence in poultry and in humans. Again, due to these countries facing challenges as lack of internet or lack of water access, it might not be very beneficial. And we do have alternative solutions, such as implementing hand hygiene pictograms for training purposes to improve compliance and awareness in the resource limited areas. Now, for countries that are capable of adopting the MagSafe sanitation technology, such as the U.S., Germany, China, and Japan, being that they have strong infrastructure and advanced technology, they can support the MagSafe sanitation technology. Some challenges they may face would be for areas that have poor internet or they have Wi-Fi limitations. And an alternative solution would be including the use of training videos as pre-recorded guides for workers and offline tracking through manual logs or offline devices to ensure compliance. Next slide, please. The cost, transport and implementation of the MagSafe sanitation would vary based on the region and infrastructure. These organizations, such as the World Health Organization and UNICEF, can also help with subsidizing costs for developing nations. And issues with transporting units to remote location would require coordination with local governments, and also combining technology with education will ensure effective prevention globally and in the U.S. from the spread of the bird flu virus. Next slide, please.
So in conclusion, our information technology solutions are ever evolving. This fast-growing industry is essential to collection and distribution of data for public health. Simple concepts such as hand hygiene can become a huge impact on infection control, especially when you tie in the IT solutions to those basic steps of the process. The MagSafe sanitation incorporates today's IT capabilities through the design and then again through collection and distribution of data from the producer to the public. We are hopeful that this innovation will be able to be introduced locally. In the COVID pandemic, a similar hand washing station was implemented in the general public to encourage frequent hand washing. A proper hand hygiene practice is being mandated with our intervention. The hope is that the spread of avian influenza will decrease from farm to public.